Ivory, who at the age of 21 had already been through a miscarriage and had an ovarian cyst condition, which placed her at high risk. This time she found herself pregnant with twins, which also put her at high risk, since African American women are 48% more likely to have preterm birth before 37 weeks compared to other ethnic groups. Not only was she high risk due to her ovarian cyst condition, but she also had preterm risk factors, including carrying multiples and being underweight. Since her public health nurse, Rochelle, had already been the home visitor of her two older sisters, Ivory knew that she was going to need more information to help her through her pregnancy. During her home visits, Rochelle checked her weight, blood pressure, and other health indicators, and encouraged her to drink plenty of water, to eat plenty of nutritious food, and that she needs to continue to follow up with prenatal care even if she felt fine. When Ivory was about 24 weeks pregnant, she started having back pain and headaches and just felt like something was not right. She went to the emergency room and they gave her medication to help prevent preterm labor and sent her home with recommendations of avoiding stress, staying off her feet, and getting plenty of rest. However, this was a difficult task since Ivory had to work 10 hours a day, was in college carrying a credit load of 20 hours, and her doctor would not place her on maternity leave. Her request was denied, despite expressing her feelings that something was not right. Ivory's public health nurse continued to monitor her and her babies closely and recommended that she follows the recommendations made by the emergency room. Despite her quitting her jobs a few weeks later, Ivory still went into labor 10 weeks early. Ivory reported, "If it wasn't for Rochelle telling me that early and heavy contractions aren't normal, there could have been a possibility that I would have delivered my babies at my job. I'm grateful to Rochelle for telling me to follow up, stay off my feet, and make sure I was getting enough nutrition." She also said of the Black Infant Health Program, "I'm so thankful for Rochelle and for her being here. She was there with me every step of the way, and I know for a fact if I was not in the home visiting program, I would be a different mom." She rated the Black Infant Health Program 11 out of a scale of 1 to 10.